my name is Kristen Waller, and my presentation is over euthanasia, which I like to call the good death. Euthanasia has a lot of controversial topics, and it has been a controversial topic for decades, and that's because you're dealing with things like patients' rights, life and death, the proper function of doctors, the ethics of suicide, the overlap between law and morality. I'm a nurse and I'm a huge advocate of patients' rights. Patients have the right to receive clear and correct diagnoses. They have a right to a second opinion. They have a right to know that diagnostic tools exist. They have the right for their doctor to communicate their treatment and financial and logistical implications it may have. Patients have a right to care that improves quality of life. There are 5 different types of euthanasia. The first one is active. It's legally prohibited here in the United States, and it's typically done by the administration of a drug or medication. Kind of reminds me of an inmate maybe getting the lethal injection. The second one is passive. It's the stopping or not even starting of treatment to a patient. So you're basically just allowing that patient to die. This is not common, and it's also prohibited. Here in the U.S., if we have a patient that is near the end of life, a family member might choose to put that patient on hospice care, and hospice would allow that patient to die peacefully and less pain, so they'd be pain-free. The third one is voluntary. You have the patient's consent to die. So maybe this patient is dying of cancer. They've been battling this for years, and you have actively given verbal or written consent to your doctor. The next one is involuntary. So with involuntary, it's the causing of death in violation of patient's rights and consents, really. The patient never consented to the doctor that they wanted to die. So this doctor killed you without your consent. The last one is non-voluntary. It's the causing of death of people who are not able to consent for themselves. So maybe I'm a patient in a coma and I can't verbally or give written consent, and the doctor goes ahead and kills me. This would be an example of non-voluntary consent. Euthanasia has a lot of ethical theories. Consequentialists look to maximize the greatest happiness for the largest number of people while minimizing pain. Consequentialists would argue that voluntary euthanasia is justifiable. I think consequentialists, they're vulnerable to a slippery slope. There's no real protection for the individual against the majority. And what I mean by that is, let's say that I'm not able to give consent to anything, to life or death, but my family's really pushing for the doctor to kill me. What's the benefit for the family? They're going to inherit all this wealth. That's just an example of a slippery slope that you can kind of get into. Deontologists, all actions are either morally right or wrong because of the type of action. The right to life and liberty. They do not forbid voluntary euthanasia. And the dilemma occurs if unwanted consequences arise. I don't think there's no single theory that can entirely sustain voluntary euthanasia, meaning there are always loopholes that can be taken advantage of. And this is where that slippery slope comes in. I feel like it rules out consequentialist theory in my mind and as a nurse. Deontologist theory is still subject to dilemmas, don't get me wrong. if wanted consequences arise. But these consequences can be addressed, I feel like, with maybe tighter regulations, limiting to smaller subset of doctors, and extensive training and unimpeachable character. Thank you.